Hi friends, this is Dr. Abdequaem Chimthanawala. Today let us discuss a very interesting remedy, the remedy which we all use, and it has some very interesting mental symptoms which I have come across in my clinical practice. I'll discuss those symptoms which I have verified in my clinical practice and used very successfully in curing patients. The remedy which I'm talking about is Lac Can, and I'll discuss some of the interesting mental symptoms of Lac Can which has led me to prescribe and treat lot of diseases with it. The first symptom of Lac Can that you should remember, it is elements from rudeness of others. Now this symptom, is such an important symptom of Lac Can that elements from rudeness, if somebody is rude to the patients, rude to that personality, that can create some symptoms in the constitution. Now with this symptom, there are so many other polygraph remedies. That's why we fail to appreciate and prescribe Lac Can for this symptom. For example, we have remedies like natromure, we have remedies like Nux vomica, calcarea, lycopodium, which has this symptom elements from rudeness of others. And this patient of Lac Can has a very typical symptom, antagonism with herself. Antagonism, the opposite. And because of this symptom, the patient in later stages develops aversion to herself. It is written aversion to herself. A very important symptom, and because of this aversion, he tries always to be contemptuous on self. These three symptoms are very important as the progress of disease, the progress of the constitution takes place. These three symptoms are important, like antagonism with herself, then aversion to herself, and contemptuous to self, contemptuous of self. These three symptoms are very important. Lac Can, if you do a good case taking, this symptom will come out in the constitution. Now antagonism with herself, there are remedies like very important remedies aurum metallicum, very important remedies lachesis, very important remedy like this lachesis aconite. So this lachesis or aconite or aurum metallicum, these remedies also have this symptom, and that's why we sometimes fail to see that symptom in Lac Can. Like you say, aversion to herself. This is again a very common symptom, a very important symptom of thuja, or you can say a very common symptom of sepia, common symptom of lycopodium, aversion to herself. And as you go further, like I said, contemptuous of self. Then we have remedies like thuja. We again have remedies like aurum metallicum. These remedies also have these symptoms. That's why sometimes we don't understand Lac Can in this context and we fail to prescribe. But believe me, these are very important entry points of Lac Can. And that's why Lac Can always, patient feels that there's a delusion that his disease is incurable, or he feels that he has a disease which is incurable. And that's how a Lac Can develops in the constitution. Like we have remedies where the patient thinks that the disease which he has is incurable. We have remedies like lachesis, we have remedies like phosphorus, we have remedies like ignitia, syphilinum, calcarea. So you see, in Lac Can, there are remedies which come very close to Lac Can, like phosphorus is there, thuja is there, lachesis is there, aurum metallicum is there, so close to Lac Can, and those are polychrist remedies, well-read remedies, well understood remedies. That's why we sometimes don't understand the importance of Lac Can. So as you go further, there's a very interesting symptom of Lac Can, that delusion of his own personal identity. Now this is important because if you feel that you are not what you are, his personal identity is lost, that means a very important syphilitic symptom is a delusion of personal identity. And again, you have to compare this symptom with the most important remedies like phosphorus, like natromure, like thuja, like lachesis, and see how all the remedies which I'm talking about are so close to Lac Can. That's why comparative mater medica is very important to understand the patient's personality, because you can have one remedy and then you can always compare which remedy suits the patient the best and which is that simillimum. And again, you see, dreams of snakes is present in lachesis, is also present in Lac Can. There are a lot of remedies, but we always think first of lachesis, but no, Lac Can also has it. And Lac Can has a typical dreams of snake, that is dreams of snake as if they're in the bed. That is Lac Can. And see, when you have that antagonism and aversion to self and contemptuous, that's why a Lac Can patient has a lot of rage, lot of fury from contradiction. He cannot bear contradiction. And whenever these symptoms come that he cannot bear contradiction, we have varieties of remedies. Again we have thuja. Again we have remedies like lycopodium, we have aurum metallicum, we have nux vomica, but we do have Lac Can also. That is why I am teaching you some comparative mater medica, so close to Lac Can, but not Lac Can sometimes. Sometimes exactly Lac Can, but we prescribe other remedies. So to find out the simillimum, it is important to know the comparative mater medica. And because of this symptom, of course, if you get angry very easily, you can't bear contradiction, there is a lot of antagonism and there's elements of rudeness. So the patient is very sensitive, especially if you feel sensitive to light is Lac Can. Sensitive to odors of flowers is also Lac Can. Like when you have sensitivity to odors of flowers, we have remedies nux vomica, we have remedies again phosphorus. See how close these remedies are with Lac Can. Or you can say sensitive to light. Again we have phosphorus. Again we have natrimur. Again we have nux vomica. This is my point for you to understand the comparative mater medica. These are the entry points of Lac Can which I have seen. And one delusion that is taught in a mater medica in a class for Lac Can is delusion floating in air. And again, my dear friends, delusion floating in air is Lac Can is there, but again, remember phosphorus is there, natrimur is there, thuja is there, and lactasis is also there. But Lac Can is also there. So see, understand these are the entry points of Lac Can which I have seen in my practice. And see how the comparative mater medica, see how remedies run close to each other, one symptom here and there. And that's why it is important to understand the importance of comparative mater medica. So my dear friends, this is something about Lac Can which I have seen in my practice. So if you like this video, do share and subscribe. Thank you.